Hello guys, welcome back to my channel. I hope you're all having a wonderful week. So today I had some time to finally sit down and just make an update video for you. It's been a couple of weeks since I've done that because the last couple of videos were on different topics. So I am just really excited to share my protocol finally because it took me a month to really get it together and to figure out exactly what I was going to do. So this video is really just to record what I've been doing so that I know for myself, and then also just to share with you what I'm about to do and what I plan to do for the coming months. I will be getting my scan tomorrow of the thoracic spine to look at that area, the one where there was a leptomeningeal spread. They essentially found something in the epidural space, so it was a bit concerning, and my oncologist wanted me to repeat the scan after 6 weeks to see if anything has grown, because if it has, then we are going to have to do something about it. So that was another reason why I really wanted to be strict, and I wanted to make this protocol so that I can do absolutely everything that I can to prevent getting any further spread and metastasis and have to deal with another treatment that I really don't want to do, like radiation. And then in the second part of the video, I'm also going to talk about all of the repurposed medications that I have been taking. I have done my own research and I know why I picked the drugs that I picked, but I just wanted to kind of give you guys a better picture of why I'm doing it and what the mechanisms are of these medications. So just stick to the end so that you can see what these drugs are and what the mechanisms of actions are. So in terms of the protocol, I talked about doing the ketogenic diet. So I have been kind of back and forth between carnivore and keto because I know that carnivore, lots of people have been trying it and it works for them. But I'm still very hesitant because with cancer, it's a lot newer and a lot of the survivors have done well on a more plant-based ketogenic diet. So I was really hesitant and I was trying to figure out what the best foods were to eat in terms of measuring my glucose and ketone levels. So what I decided to do was to just mix it and to do clean animal products, and then still have some vegetables and some fruits. But I have completely cut out all processed carbohydrates and grains. So that includes like rice, bread, pasta, obviously any refined sugars and snacks. I eat all whole foods. So it's basically just vegetables and not starchy vegetables either. So above the ground vegetables and very little fruit, mostly berries and maybe green apple here or there. Coconut, I eat very low sugar fruits. And then I will have clean meats, and I am choosing to do mostly ruminant meats, which means that doesn't include pork and processed meats like bacon and sausage, not much chicken. I haven't really even done fish, but just because I haven't really wanted to eat it, but I will allow myself to eat small fish like mackerel and sardines. I just haven't really wanted to eat that. And then a very high fat diet because obviously I want to be in ketosis and to have my TKI as low as possible. So I actually got a continuous glucose monitor. I just installed it yesterday. It's like right here. So I got it from a company called Signos. I just went online and saw how I could get one without a prescription because I don't have diabetes, and you can actually get one on your own, but most of the time you have to pay some sort of a third party for them to have a doctor to prescribe it for you, and then they have an app that goes with it that you can use and track. And so I paid for that. I paid for like a 3-month period because I wanted to know what my sugars were doing, if I eat certain types of foods or if I'm exercising or if I'm having stress. So it just really helps me to see the numbers and to help keep me accountable, because I think if I see that I ate something and the glucose spikes, then I'm like, oh gosh, I can't eat that next time. And I've been following the Glucose Goddess on YouTube, and she wrote a book called The Glucose Revolution. So I have started to read that, and it kind of just gives you hacks and different things that you can do to reduce your glucose spikes, like the order of how you eat foods, for example, or drinking vinegar before you eat, or exercising after eating, things like that. So I haven't gotten through the book yet, but I am going to read that while I have my continuous glucose monitor so that I can see it. I just got it yesterday. So so far I've seen a huge sugar spike when I ate yesterday, and it was because I cheated and ate a couple of egg rolls. But after that, I was good, and today I ate well, and it looks like it's a very steady rise in the glucose, which is what you want. You don't want this like huge spike and then huge dip. You want it to kind of like go like this, you know, up and down. So because the glucose spikes are pretty harmful and inflammatory, and this is kind of what happens, and that's really where the damage is done. So that's how I'm keeping track of my glucose. My GKI, I still have my Keto Mojo, so I will check that as well to see what the ketones are, because the glucose monitor doesn't tell you that. But I think at this point, I have a feel of it, and I know when I'm in ketosis, and usually it's from when I'm in a pretty fasted state. So I will start eating around 11 o'clock usually, and then I stop eating after 6 p.m. I try to intermittent fast that way so that I can stay in ketosis for longer, but I think eventually I might have to start eating breakfast because my goal is to gain weight and to build muscle, and I've been going to the gym. I've been working with a trainer twice a week. I decided to shell out the money for that. I've been spending a lot of money on health stuff, but you know, it's worth it, and it's better than spending it on other things like clothes or dinner out or something. So I don't really spend any money on anything besides my kids and health stuff. So I paid for the trainer, and I go twice a week with him, and then I do 2 other workouts on my own. And then on the days that I am not strength training and working out at the gym, then I'll go for the sauna and do hot cold therapy and walking and other types of things for my health. And I recently started going to this place for the infrared sauna. It was awesome because I met the guy, and he actually makes juices and the ginger shots. I think I talked about that in my last video where I talked about the die-off reactions. And he makes these juices and ginger shots. I just went there yesterday, and he made this green juice with cucumber, celery, kale, and lemon or something else, like, oh, green apple. So I drank that, and then I drank the ginger shot, the immune one, and it was really good. And he said that he has clients that he makes it for and sells it to. So I was like, oh wow, I'm definitely interested in that because I've been wanting to make it at home myself, but I haven't had the time, and I honestly don't do it because I just don't have the time. I start work at like 6 in the morning, and it's really hard for me to go downstairs and juice and make everything when I don't really get a lunch break until 11 o'clock. So I would have to kind of try to do it in between work, and that's really not possible when it's so busy. So I haven't been able to do that, and I've been trying to think of ways to get these immune boosting shots because I don't really want to juice heavily, especially with the carrot juice and stuff, because it has a lot of carbohydrates. But I wanted to at least do a green juice, or at least the ginger immune shot. I looked up some recipes, and I saw that people made it with ginger, turmeric, lemon, and then some people added orange and carrots as a base for it. So I told him, you know, that I wanted the turmeric in it. So he was like, okay, I'll make it for you. So this is great. So today I'm actually going to pick up the first order from him. He doesn't charge very much. It's actually very reasonable. It's cheaper than getting it at the supermarket, and it's much more fresh, and it has all organic ingredients and ingredients that I want in it. So he's making a gallon of the ginger one for me, and then he's making another one of the green juice. So I'm really excited about that, to be able to add that on in addition to my anti-cancer protocol. So I've got the diet figured out. I've got the juices figured out. I've got the exercise figured out. And then I recently just finished devising my whole repurposed drug list plus my supplement list, and I've been able to slowly reintroduce them one by one, and I've been tolerating them all actually very well, and I've been sleeping better. I've been feeling better. I haven't been as sore working out. I feel stronger. I mean, overall, everything is really going well, and I feel like my body is starting to heal. The rib pain has been much, much less. I still feel it, but it's not nearly what it was before. Like, I just don't feel inflamed, and I feel so mentally well. You know, like when you have that clarity and when you just are in the zone. And I just feel like I'm in the zone and I'm just ready to conquer this. I'm pretty excited to see what's going to happen with my next set of scans, which is not going to be in until July. But like I said, I do have that MRI coming up tomorrow. So hopefully that will at least be stable and not show anything crazy. And I will let you guys know the result of that as soon as I get it. Okay. And the other thing is that I actually just found a traditional Chinese medicine acupuncturist that came highly referred, and I booked an appointment for next week. So I'm really excited about that as well, because she does not only the acupuncture but the traditional Chinese medicine, including herbs. So I'm pretty interested in that, and I want to see what she has to recommend for me. So that's another thing that I'm doing. And on my days off, I discovered that there's like a Korean sauna in my area, and they charge like $40 for you to get in for the whole day. And you can pretty much just go into the hot tubs, and then they have the cold plunge area, and then they have like 10 different dry saunas that has Himalayan salt and charcoal and jade and all sorts of stuff. I don't know if you guys have ever been to a Korean sauna, but it's the best. And so I just go there on my days off and spend like half the morning and afternoon there, and it's so relaxing. And I went last week and it was pretty awesome. So I have lots of things that I can do and lots of things that I plan to do on my days off now. And I'm just kind of going back to how I was before, when I used to do all these things. And that was really how I beat cancer. It's like a full-time job. And if you really want to heal, you have to prioritize yourself and you have to prioritize your health. And these are not selfish things. These are things that you need in order to live a better quality of life. So I totally encourage everyone to do that, to find things that you can do that are relaxing for yourselves, and make sure you take those breaks. We can't just be on the go, go, go all the time. Okay, so I'm going to go into the next section. And in this section, we're going to be talking about the 7 different repurposed drugs that I take and the mechanisms of action. I'm going to be looking at my notes because it's a lot and I can't remember it all. I mean, I have a vague idea, but I just don't want to forget anything. So don't mind me if I'm going to be using some notes and going over some things, okay? So on to this next part of the video, and I totally realized after I recorded before that the mic wasn't even on the whole time, but I am not going to re-record it. So sorry about that, but hopefully the mic is on now. So in this section, when we talk about the repurposed drugs, I don't know if you guys have heard of Jane McLellan, and she is the one that wrote the book called How to Starve Cancer. And in her book, she talks about the metabolic approach to cancer, which I've been talking about in my videos. And she talks about targeting all of the different pathways of how cancer cells will utilize the fuel source and how they basically get around to surviving. So the idea is to target all of these pathways using these drugs in order to block the fuel source for the cancer, and then thereby you starve the cancer. What a repurposed drug is a medication that has been FDA approved for something else, but then it's being repurposed or reused for the effects of cancer. There's hundreds of published studies on all of these different types of drugs, and this is not something new. It's been known. It's just that it's understudied, and we need to do way more research for that. But unfortunately, when you have cancer, you really don't have the time to wait for these things to become official, and you can't wait for human studies. It's definitely something that not everybody's going to be willing to do. And again, this is really just what I am doing. I am not giving you medical advice. I'm not telling you to go and take these drugs. And please, please, please do your own research before you take anything, and please talk to your doctor to see if it's right for you. I do have multiple doctors that I that take care of me and that know that I'm taking these drugs, that are monitoring me, and I'm monitoring myself. I do a lot of research on this, so I feel confident to take them. And if side effects develop, then I will be sure to bring it up and manage that. I get blood work done pretty regularly for my infusions monthlies, and I just had them done yesterday and they were great. Well, let's get into what I take. And also, I chose all of these specific drugs for my type of cancer because Jane also encourages you to research your own type of cancer and the pathways that it uses. And then there are certain supplements and drugs that are better for your cancer versus my cancer. So don't take my word for it. But with that being said, many of these drugs that I chose work very well for a lot of different types of cancers. And I choose them because they have synergy with one another, they target multiple pathways, and they're just really good in general for a lot of things. So I like to kind of kill two birds with one stone. I don't like to take something that is not going to be very effective or just effective for one thing, you know what I mean? So the first drug that I'm taking is Ivermectin. As you all know, Ivermectin is an anti-parasitic drug, and it also has like antiviral and antibacterial properties as well. I found that a couple articles that talked about how it's synergistic with doxorubicin, which is a chemotherapy agent that they use for osteosarcoma, and it's synergistic with that, and it's also synergistic with certain types of immunotherapies like in triple negative breast cancer with the immune checkpoint blockade. And I take an immunotherapy, so that was something that jumped out at me, and that's why I was interested in the medication. And it also is synergistic with the tyrosine kinase inhibitors, which is another class of targeted drugs for my type of cancer. I am not on it now, but I used to be, and that's why I used to take Ivermectin as well. I took it for a while, like a long time ago, and that's why I have like a huge supply of it. And so I didn't want to waste it, and so this time I resumed and started it again. It also inhibits the cancer cells and tumor metastasis, so it basically like suppresses the expressions of migration-related proteins through certain pathways like the WNT and beta-catenin pathways, which I'll keep talking about, but that pathway is pretty important for metastasis and for cancer stem cells and stuff like that. It also inhibits mTOR, which is another pretty big pathway that has to do with autophagy. It's like the recycling of cells, and it's a little bit complex because there's a normal autophagy pathway, and then there's like the pathway that cancer cells use in order to try to stay alive. So Ivermectin will target this pathway, and it has been known to reverse drug resistance. So if you have chemotherapy resistance and drug resistance, it can help with that. The second drug that I'm taking, and this is a big one that we all know about, and it's the list is huge of the benefits, and I think this is definitely one of the big guns that pretty much every cancer patient should try, as long as it's right for you and it's not going to cause any side effects. I mean, it just targets so many pathways. So that's Mebendazole, and I had already mentioned that I'm taking that. The other drug that you guys know of is Mebendazole, which is similar to Mebendazole and has a lot of the same benefits. They are, a little bit different, but I chose to take Mebendazole because it's the human version, and I don't know, I just would rather take the human version. So Mebendazole inhibits tubulin polymerization. So this is similar to actually vincristine and vinblastine. It's similar to chemotherapy in how it works, and my oncologist knows that very well as well. He brought that up when I said that I was taking it. So you have these microtubules that are components of the spindle structures in the cell, and it's used in cell division, and this is known as mitosis. So Mebendazole, it disrupts this whole process, the microtubular structure, and therefore it inhibits the cell division, and obviously you need that in order to get the cancer to keep dividing and growing. So it disrupts that whole process. It also is an anti-angiogenesis, so that's inhibiting blood vessel growth. As you know, my type of sarcoma is very vascular, and it feeds off blood vessels, and the targeted therapy that they have is to block that whole process, so that's really good for me. It also inhibits the matrix metalloproteinases, the MMP. So that's really important in terms of getting the cancer cells to grow and spread. Like, it kind of degrades this extracellular matrix, and that enhances its ability to migrate, to metastasize through the tissues and spread. So Mebendazole will inhibit this process, and so thereby increase programmed cell death, or the other name for that is apoptosis. It also has anti-tumor immune response. It can arrest the tumor growth in general. It improves survival. It synergizes with chemotherapy and radiation. It makes it more effective. And it also synergizes with a lot of other repurposed drugs that I'm taking, like Niclosamide, Loratadine, Propranolol, and Metformin, Ivermectin, Mebendazole, diclofenac. There's a bunch, but I'm not going to talk about some of those other drugs because I'm not taking them, but I am taking a bunch of drugs that do synergize with it. So that was really good for me. Mebendazole, in addition to that, mimics the structure of glucose, and so it decreases the glucose consumption through inhibiting the glycolysis pathway. Mebendazole also does lower the glucose levels as well, from what I saw. And the next one that I take is Niclosamide. It's another anti-parasitic drug, and again, it targets that pathway, the WNT beta-catenin pathway, which then leads to decreased proliferation and cancer cell death. And it's also acts as an anti-cancer stem cell agent. So cancer stem cells are really problematic because when you get chemotherapy, it kills off the fast dividing cells, because you have the fast dividing cells when it comes to cancer, and then you have the cancer stem cells. So what we don't really target is the cancer stem cells, and in fact, when you get chemotherapy, it increases your risk of developing more cancer stem cells. And so this is how people end up getting recurrence. And when it comes back, it's even harder to treat because there's a lot of drug resistance, because these cancer stem cells are pretty much the only ones that are surviving, and they've learned a way to get around what happened, like to use a different pathway. And so they're a lot more advanced and smarter, and it's a lot harder to kill them off. So a lot of these repurposed drugs are targeted towards the cancer stem cells, which are so important in your long-term survival. This Niclosamide, it's a pretty special medication, and it targets all three pillars of the cancer cell metabolism, and that includes glycolysis and the OXPHOS pathway, and also the autophagy, which I talked about before. It also induces the cell cycle arrest, growth inhibition, apoptosis. So at this point, you're kind of familiar with these terms that I'm using now. It also has antiviral and antibacterial properties, like it works against H. pylori, COVID. I don't know if I'm supposed to say that on the video or not, but anyway, so it's synergistic with chemotherapy and with radiation, and it helps with when you have resistance to chemotherapy, and it also acts synergistically with immune checkpoint inhibitors. So as you can see, all three of these drugs kind of do the same type of thing, and they are synergistic with one another. And so my integrative doctor thought I should take all three. So I'm taking all three of them, and I'm taking them at the same time. The Mebendazole I do once a day for now, but I'm going to probably change it to twice a day. The Niclosamide I do twice a day, Ivermectin once a day, and then I'll do 3 days on, 4 days off, because I've been tolerating it that way, and later on maybe I'll switch that, who knows. So those are like the 3 really important drugs that I take. And then I take aspirin. And aspirin also acts on the cancer stem cells. And aspirin is an antiplatelet, anti-inflammatory. So it inhibits the inflammation via multiple pathways. The inflammation signaling induces aggressive cancer behavior, proliferation, migration, angiogenesis, metastasis, right? And then it also suppresses the immunity. So aspirin will be good for the immune system, so that's good. And then it also prevents the NF-kappa B activation, so that it can help you overcome resistance to chemotherapy and targeted treatments like TKIs. It's synergistic, again, with other drugs, including metformin and some of the ones that I'm taking. And it also inhibits glycolysis. So aspirin is pretty great. There's a lot of data on aspirin if you look it up. And a lot of these are, you can just do like a quick PubMed search, or just a quick search on the internet. Like if you're curious to see how it works against your type of cancer, you just type in aspirin plus breast cancer or something like that. Or you just type in aspirin repurposed drug and it'll come up. So there's so much on it, and so I can't post all of the articles on here that I'm referencing, and I'm also using a lot of references from Jane's book and from another book called what is it called? The Cancer Toolkit by Dr. Jeffrey Dack, and he put a lot of the references together, so you guys can reference that book as well if you want. And then on to the next drug is going to be Loratadine. So Loratadine, I'm sure you've heard of it. It's an antihistamine. We use it for allergies. The brand name is Claritin. I first heard of it when they told me to take it when I had my Zometa infusion. And I had a lot of side effects from it, like kind of like flu-like symptoms and bone pain and all that. And so they told me to take Loratadine and Tylenol. So I was just kind of curious how that worked, but apparently it really modulates the immune system, and they do use it for chemo side effects like bone pain. It again it works on kind of similar to the other drugs. So the autophagy induces apoptosis, and it works synergistically with chemo and radiation, and it also is synergistic with immunotherapy, which I am on. So I pick all of these drugs that help with the immunotherapy. I just added Propranolol, and Propranolol is something I've been wanting to take forever because it's very good for sarcomas, my type specifically because of the anti-angiogenesis effects of it. So it really blocks the growth factors like VEGF and blood vessel growth. And what it is it basically works on the adrenaline receptors. You have your beta 1 and beta 2 receptors, and it works on both. So generally we use it to lower blood pressure and heart rate, and it's used for like social anxiety too, because the adrenaline gets released like the norepinephrine, and epinephrine, it gets released when you are under stress. So this kind of helps with that. And these neurotransmitters, they can influence cancer progression by enhancing tumor-related inflammatory signaling, tumor cell invasion and migration, and formation of new blood and lymph vessels, as I talked about. It also works on autophagy and through the mitochondria via the glycolysis and OXPHOS pathways, which are both energy pathways for the cell. And it restores anti-tumor immune function. So, so it has a lot of good stuff, and especially for my type of sarcoma. So I was just really kind of afraid to take it because I didn't want my blood pressure and heart rate to drop and for it to affect my exercise and things like that, because my blood pressure is already low. But I've been taking it at a low dose and I've been tolerating it fine. I haven't had any side effects, so that's good. And then the last thing that I take is low dose Naltrexone, and I've been on this medication for some time now. There's not as much evidence on it in terms of its usage for cancer, so I don't really know. It was recommended to me by my naturopath, so I've just been taking it. Initially, we use it for at a higher dose, at the 50 milligram dose, for alcohol and opiate addictions, but at the low dose of 4.5 milligrams daily, it's used for autoimmune conditions like fibromyalgia and MS. And well, hello chicken. My cat is meowing. Hi, come up. Come. Okay, come say hi. Okay, well, chicken is here. So yeah, so it's used off-label for fibromyalgia and MS and Crohn's disease, and it really helps with the chronic pain from these conditions. So how it works with cancer is that it has more of an immunomodulatory effect. It binds to the opioid receptors, which are actually overexpressed in different types of cancers, and it thereby suppresses tumor proliferation and regulates the tumor microenvironment and promotes anti-tumor immunity. It also binds the toll-like receptor 4 and disrupts the whole pro-inflammatory response, which we know is pretty prominent in cancer. And then it also can reduce tumor growth by interfering with cell signaling. So I have been taking it 4 days on and 3 days off. So on the days that I don't take the anti-parasitic drugs, I'll do the low-dose Naltrexone, and you have to get it from a pharmacy, like a compounding pharmacy, where they can give you the lower dose and then go up. So a lot of these drugs are either prescribed through your doctor, or you would have to get it through a compounding pharmacy. Sometimes you can buy them online, but I'm not going to really get into that for the purposes of today's video. So I know it's been a long video, but I really just kind of wanted to explain to you guys what these drugs are, why I'm taking them, and I know it's a lot, and but it's definitely not as much as some people that I know that are taking a lot more. My supplement list is not too bad either, but I will make a separate video about that at some point. So yeah, so that's it for today's video. Thank you so much for watching and for listening. I hope you got some useful information out of this. And please comment below if you have any questions, any suggestions for me. As usual, I'm always so grateful for all of you, my YouTube family. So I hope you all have a wonderful rest of your week and weekend, and I will see you in the next video. Okay, bye. Okay, bye, chicken. Say bye. Okay, chicken says bye.